In this video, we will be doing a scan of the anterior neck. For this scan, we will be using the high-frequency linear transducer. This scan is obtained by placing the transducer in the transverse plane in the midline of the lower third of the anterior neck. During this scan, we expect to see the following structures: the thyroid gland, including its isthmus, the trachea, the common carotid artery, the internal jugular vein, the sternocleidomastoid muscle, and other strap muscles of the neck. Okay, so now we're ready to start scanning. The depth should be set initially to somewhere between 3 and 5 centimeters. This can be adjusted later to optimize the image. The transducer is in the transverse plane. The direction marker on the transducer corresponds with that on the screen and indicates a patient right direction. Slide the transducer cranially and caudally until the thyroid gland is visualized. Note the hyperechogenic homogeneous appearance of the thyroid gland. Identify the right and left lobes of the thyroid gland. Identify the thyroid isthmus. Identify the trachea. Note the hyperechogenic tracheal cartilage. Identify the anterior strap muscles of the neck. Identify the sternocleidomastoid muscle. Slide the transducer laterally to the patient's left. The sternocleidomastoid muscle is now more prominent. Just deep to the sternocleidomastoid are two anechoic spheres. Anechoic is the absence of echoes and appears black on ultrasound. These two structures are the internal jugular vein and the common carotid artery. The internal jugular vein lies lateral to the common carotid artery. It is larger and more oval in shape. The common carotid artery is more circular, lies medial to the internal jugular vein, and its wall appears thicker. Apply gentle downward pressure on the transducer and note how the vein is compressible, whereas the artery is not. Both vessels have a degree of pulsatility. Next, slide the transducer to the patient's right and again identify the internal jugular vein and common carotid artery. This completes the scan of the anterior neck. Clinical note: this view of the neck is utilized by physicians from a number of specialties. Emergency physicians and intensive care physicians will frequently use this view to identify the internal jugular vein and to guide central venous cannulation. Some endocrine physicians will use this view to assess the thyroid for the presence of nodules or cysts.